If there's one topic we just cannot avoid in 2020, it's healthcare. Even before COVID-19, our nation was facing a shortage of healthcare workers, a shortage that was partially mitigated by immigrants. And many of these immigrants who are working in healthcare are now working on the front lines of the coronavirus response. But there's no easy path for them to remain in the United States.
Only in America.
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 Welcome back to Only in America. I'm Ali Nirani. Immigrants are essential to our nation's health, whether they work in medical or non-medical professions. They make up a major part of our healthcare industry. They're doctors, nurses, personal care attendants. They're preparing food and keeping facilities clean. They're caring for the elderly. They're researching coronavirus vaccines. Immigrants represent 17% of all workers in healthcare occupations in the U.S. They also represent 24% of all direct care workers, like nurses, psychiatric, and home health aides. And immigrants account for a whopping 28% of highly skilled professionals, such as physicians and surgeons. Now, these include DACA recipients, TPS holders, undocumented immigrants, and H-1B visa holders, among many other immigrants in the U.S. And they're all indispensable to the healthcare workforce. Their contributions are especially visible as our nation responds to this global pandemic. Immigrants working in healthcare on the front lines of the coronavirus response. But even when this pandemic eases and we gradually return to our everyday lives, shortages will continue in our healthcare workforce. For example, the U.S. is facing a serious shortage of primary care physicians, one that could grow as large as 120,000 physicians by 2030. This gap has an outsized effect on rural towns because they have fewer doctors per capita than urban areas. Now, through our response and recovery to COVID-19, a new light has been shed on the essential work of immigrants in healthcare, work that will continue to be critical as our nation ages and grows. In this series, we'll speak to the healthcare professionals facing these challenges firsthand. We'll hear from them how we can keep our communities healthy, and we'll look at how America can ensure a stable healthcare workforce, one without barriers for immigrant medical professionals and healthcare workers. And we'll see how our current immigration policies ultimately could leave us all less healthy. Make sure to subscribe to Only in America to hear all the episodes in this series. You can learn more at www.immigrationforum.org/podcast. I'm Ali Nirani. Thank you for listening, and I will talk to you next week.